Irritable bowel syndrome, or IBS, is the most common functional gastrointestinal disorder with worldwide prevalence rates ranging from 9 to 23%. Functional disorders are conditions where there is an absence of structural or biochemical abnormalities on the common diagnostic test, which could normally explain symptoms. Most people with IBS have mild symptoms. However, many people don't recognize what they are. Yet IBS is one of the most common disorders seen by physicians. Not all individuals with IBS symptoms seek medical care. Nevertheless, there are between 2.4 and 3.5 million annual physician visits for IBS in the United States alone. IBS affects both men and women, but approximately 60 to 65% of individuals who report IBS in the community are female. And the cost to society in terms of direct medical expenses and indirect costs associated with the loss of productivity and work absenteeism is considerable. Estimates range from $21 billion or more annually. The digestion and propulsion of nutrients and fluids through the gastrointestinal system is a very complicated and a well-organized process. In fact, the GI tract has its own intrinsic muscles and nerves that connect like an electrical circuit to the spinal cord and brain. Neuromuscular events occurring in the GI tract are relayed to the brain through neural connections, and the response of the brain is also relayed back to the gastrointestinal tract. As a result of this activity, motility and sensation in the bowel are generated, and abnormality in this process results in the disordered propulsion of the intestinal contents, which generates the sensation of pain. The digestion and propulsion of nutrients and fluids through the GI system is a very complicated and a very well organized process. The GI tract has its own intrinsic muscles and nerves that connect like an electrical circuit to the spinal cord and brain. And the exact cause of IBS is unknown. One theory is a person with IBS may have a colon that is more sensitive and reactive than usual, so it responds strongly to stimuli that would not affect others. The colon muscle of a person with IBS then begins to spasm after only mild stimulation or ordinary events such as the following: eating, distension from gas or other material in the colon, certain medications, and certain foods. And it's a fact that women with IBS seem to have more symptoms during their menstrual periods, suggesting that reproductive hormones can increase IBS symptoms. Some common symptoms of IBS are constipation, diarrhea, and cramping. Patients with irritable bowel syndrome may experience IBS symptoms differently from one another and may experience one or all of the following symptoms: abdominal pain, abdominal cramping, bloating, painful constipation and painful diarrhea, and abnormal gas. Alternating bouts of constipation and diarrhea and mucus in the bowel are several others. You can treat IBS by adhering to a high-fiber irritable bowel syndrome diet, which can eliminate foods that trigger intestinal distress. Through the use of probiotics, irritable bowel syndrome symptoms can decrease. In addition to dietary changes, many treatment plans incorporate stress reduction techniques and/or counsel as effective IBS treatment methods. Sometimes medication may prove necessary, but often you'll do better to identify and address the underlying causes of the digesting problem yourself. A well-functioning digestive system has an awful lot to do with what you put in your mouth, what happens to it before it reaches the large intestine, and whether you have the appropriate balance of bacteria in your large intestine. Some items that you can do to help relieve IBS syndrome is to be picky about what you eat or drink. You need to try to eat more whole foods, monitor food combinations, keep fluids with meals to a minimum, chew food thoroughly, and don't combine white foods with saturated fats. Now, if you feel like you suffer from symptoms described in this presentation, please consult your family physician immediately. For additional information on IBS diets and natural cures, go to www.consumerproven.com/IBS cure. There is a natural cure.